Everyone, in this video we'll be discussing on the topic of our cardiovascular and its complication in the case of the patient suffering from diabetes mellitus. And first of all, we have to know what is diabetes mellitus. So diabetes mellitus is a group of disease that is associated with increase in the concentration of glucose in the blood, and this increase in glucose concentration in blood is called as hyperglycemia, and which is due to the insufficient release of insulin inside the body, which is released by an organ in our body, which is pancreas. Okay, so after that we have the classification for this diabetes, and we have two types of diabetes mellitus. We have type 1 diabetes and type 2 diabetes mellitus. So we have some differences here. This type 1 is manifested in childhood, and this type 2 is manifested over the basically in adults who are above the age of 45 years. And in this case, for the treatment or for prophylaxis, we need an immediately insulin therapy in the case of type 1 diabetes mellitus. In this we have anti-diabetic drugs, okay, and they are more common than type 1 diabetes mellitus. Okay, so type 2 diabetes mellitus is mostly common. So just we will be referring one image here to understand the concept here. So just consider this is your type 1 diabetes mellitus. Pancreas produces insufficient insulin. Okay, so just consider this is your type 1, this is a pancreas, and pancreas is producing a little insulin, and because of that your glucose level inside the blood is increasing. So insulin actually decreases your blood glucose level, that is the glucose inside the blood. The insulin is a hormone, okay, polypeptide hormone, which actually decreases your concentration of glucose inside the blood. So that does not lead to case of hyperglycemia. If this insulin is not released in insufficient amount, then this will lead to the increase in the blood glucose level. So this is the case which occurs in the type 1 diabetes mellitus. So what happens with the case of type 2 diabetes mellitus? You can see in this brief image for type 2, you see this is your body, and this is your stomach, and this one is your pancreas. Okay, so which is just located under the duodenum, concave part of the duodenum. So pancreas produces the sufficient insulin, but it is resistant to the effective use. So the body is this insulin is actually resistant to its use. Now in type 2, the insulin is being produced in a prominent amount or in the normal amount, but this our body or the concentration level inside the blood is resistant to the insulin. So that is why there is increase in the glucose level inside the blood. So stomach converts the food to glucose firstly, and glucose enters the bloodstream, and after that pancreas produces sufficient insulin. That was not the like case with the type 1, in which insufficient insulin was produced, but here the insulin is produced sufficiently, but it is resistant to the effective use, and glucose unable to enter the body effectively. So from the blood, the glucose is not being able to transport to the other organs, and that is why there is accumulation of glucose inside the blood, and that leads to the case of hyperglycemia, and which leads to the increase in the glucose level in the patient with adults over age of 45 or in the older age. So this diabetes is mostly common in the age of you can see in the adults or who are above 50 years. Okay, so this comes as a later complication, type 2 diabetes. Same here, you can see insulin produced is resistant to its use. Insulin is sufficient, you can see this here, only this less amount in type 1. Here insulin is in bulk amount, but our body is resistant to insulin. So that is why we used to give anti-diabetic drugs to the patient with type 2 diabetes. Now chronic hyperglycemia, if the patient is having hyperglycemia from a longer time, then it can lead to the complication of the cardiovascular organs like heart and blood vessels, which can lead to macroangiopathies and microangiopathies. Now what are the prevalence of diabetes in worldwide? What are the statistics for this diabetes? So cause of the mortality in all age groups and among all the male and female. So it is the death for in all the age groups and on all the gender. And the main cause for this prevalence is due to the obesity or poor lifestyle or poor diet or sedentary lifestyle. So the persons who are not doing any exercises or only eating and sitting, so that persons are prone to develop diabetes. Since 1980, there has been doubled increase in the 60% of cases in women and doubled in the women. Okay, sorry, this will be men. So in 60% increase in the case of women and double in the amount of men since 1980. And 6.1% diabetes mellitus in 2018 worldwide. 6.4% out of the diabetes mellitus patients were having diabetes in around 2010, and most commonly it occurs in men and Negroes and Mexican Americans. Okay, so this is the case. And diabetes mellitus is major risk factor for the cardiovascular disease and associated with other causes of pathologies such as hyperlipidemia, hypertension and obesity. So this is increase in the level of your fats, and this is your increase in your arterial blood pressure and obesities. Okay, and in 1997 there was a study told there is equal risk of CVD with the diabetes mellitus patient and the persons who have previous myocardial infarction. So they have the equal risk to develop cardiovascular disease. The same with the diabetic patient and same with the past MI pathology the person is having. So it is a equivalent chance. Now what are the pathologies that diabetes is able to risk the patients? So we have ischemic heart disease, which can develop as a complication heart failure, atrial fibrillation, stroke, and patient with diabetes die earlier than the patient with cardiovascular disease not with diabetes mellitus. So meaning is that the patient who is having diabetes and later on he or she is having the complication of cardiovascular disease, so he will die earlier than the patient who is having only the cardiovascular disease. So that is the main case. Now what are the etiology and pathophysiology in cardiovascular diabetes mellitus? So it causes damage to the body tissues due to the violation of concentration of glucose in the body, as I told you, and this leads to the elevated glucose level, and further this can lead to your atherosclerosis. You know atherosclerosis, it is an accumulation of plaques or fatty deposit inside the blood vessels, and which narrows your blood vessel, and due to which there is increase in the blood pressure. Okay, so vasoconstriction will occur and your blood pressure will be raised, and there will be microvascular complication also, and there will be presence of RAS mechanism for RAS, that is renin angiotensin converting system, and mechanism for diabetes mellitus and cardiovascular diseases. So in this case we have obesity induced diabetes, which increase insulin in pancreas, and obesity induced inflammation, adipose tissues in overweight people, and people attracts immune cells that trigger your chronic inflammation. So there is chances of occurring of any inflammation which can lead to the chronic form, that is it can continue for longer years. Now third case pathophysio is the contribution of other cardiovascular disease risk factors such as hypertension, hyperlipidemia, and they both coexist in diabetes mellitus patients. So has a hypertension patient an increase in the lipid level or fat inside his or her body. So now adipose tissue surrounding the heart has an increased risk for left ventricular hypertrophy. If there is any adipose tissue surrounding your heart, okay, so pericardium, so it can has a chances of developing of your left ventricular hypertrophy, meaning is that the increase in the size of your ventricles, left side ventricles. So this will lead to increase in the blood pressure of the your body, and will further lead to many cardiovascular diseases. So that is the coronary artery disease, heart failure, and atrial fibrillation. And dyslipidemia is a major risk factor for cardiovascular system in patients, CVS. Okay, and low HDL and high LDL. So the patient having diabetes mellitus are prone to suffer with low good cholesterol. HDL is good cholesterol, which is decreased in the patient, and high LDL is bad cholesterol. So this is very danger for the patient. Okay, so they have if you do the lipid profile of their patient, you will see this scenario. And there can be genetic cause for this also. Genetic cause, diabetes is a genetic factor in play from your ancestors also. So genetic predisposition, impact or epigenetic factors, and there can be case of apoptosis, that is a programmed cell death, increase in the diabetes than in the patient with diabetes. Okay, so that is the case, that is your diabetes mellitus and with respect to your cardiovascular disease. Thank you.